It's not only connecting with other members that I enjoy as a Rotarian, but also with other organizations that share our commitment to keeping communities connected and making them healthier, safer, and better prepared. We know from our work in polio eradication and our areas of focus that the impact we make is greater when we leverage the expertise of our partners. I interviewed leaders from several of our global polio eradication initiative partners about what they've learned as they've mobilized their own experts over the past few months. They were generous enough to share their thoughts about how Rotary can be at the forefront of a new effort to safeguard our communities and the world. Let's take a look. Let's talk about the infrastructure from the polio eradication efforts used by governments and other organizations to respond to community needs emerging from COVID-19. How has the legacy of polio eradication informed the global health response to COVID-19?
What we've done in polio is we've trained for an emergency like COVID. So all of the things that you see that are needed in COVID are the ones that we have put in place for polio. And I will highlight one that I hear from all of my friends at WHO, at CDC, at all of the health ministries around the world. And it is the joint work that Rotarians and UNICEF and all of our partners have done to create community health workers. They are the backbone, they are the strength of the community engagement. And that all came from our work on polio. The capacities that we put in place as a partnership are there to be utilized. So every Rotarian should feel so pleased and proud that the infrastructure we have in place is now being used for the world against COVID.
You know, in 35 years, the global polio eradication effort has built up incredible assets, laboratory testing, surveillance, a frontline workforce that of hundreds of thousands who deliver vaccines and polio campaigns around the world. In pretty much every country where the polio eradication initiative is active, which is over 50 countries, those assets have been dedicated to the COVID-19 response. So a lot of the frontline workers doing the contact tracing, doing the surveillance, looking for cases of COVID-19 are polio workers. I was in a discussion last week with the Minister of Health in Pakistan, and he was thanking me and thanking the Rotary and the rest of the polio partnership for how useful the polio team in Pakistan has been in responding to the COVID-19 outbreak there. And that's true in many countries. I just read this morning a very nice piece written by Shidi Moeti, the African Regional Director for the World Health Organization, has an important piece about how the polio teams throughout Africa are being used in the COVID response. Again, the frontline workers, but also the laboratories, the surveillance systems, et cetera. So the world is benefiting, particularly in the poorest countries where we've been chasing down the last cases of polio. We're greatly benefiting from the infrastructure that the polio initiative has built over the last three decades.
The polio infrastructure that Rotarians have helped build and sustained is already being used to address and to be able to inform global health response to COVID-19 as we stop the spread. And I want to just give a few examples of this. The Stop Transmission of Polio are people that we put on the ground to help with surveillance, to make sure we can detect, to help that we have real-time data for decision making. And STOP teams have been heavily engaged at country level. In early May, in 32 countries where we have Stop Transmission of Polio officers, 48% of their time has been spent on COVID-19 activities, doing contact tracing. So if somebody's positive for COVID-19, tracing the contacts for that case. Also, making sure that the communication planning is done about physical distancing, about the need to make sure of quarantining as well for cases and contacts as needed. And the importance of the data analysis and collection. These components have already been in play. We have seen this in Nigeria, in Liberia as well. And in Pakistan, over 18,000 GPEI workers are helping with health worker training, infection prevention control measures, and also risk communication. So we see already a large response of polio supporting the COVID-19 response.
What lessons can Rotary apply from both our partnership and our polio eradication experience to better define and measure impact in our other work, like combating illiteracy and poverty, championing peace, and fighting other diseases?
I think what we really have come to respect and rely on with Rotary is the tremendous grassroots organization that you are, the confidence that you have of your communities, the presence that you have in your communities. And I think one of the greatest assets is the ability to draw on that in times of challenge. And when we have great challenging initiatives like the effort we've set out on to eradicate polio, now to control COVID, and there will be other challenges in front of us. And in the little bit of peacetime that we have between all of these challenges, Rotary's ongoing work to build those deep links with communities, to be relevant to your communities, to do good for your communities, is building the foundation on which partners like us, like the World Health Organization, can then leverage, and I mean this in the most positive way, for the greater good when it comes to specific diseases or disasters that we may have to face, because you build trust, you build those communities, those local partnerships in peacetime, and the continued club level work in Rotary to be listening to the communities, responding with the projects and initiatives that the communities want. Because then when it comes to the big crises, you built the bridges that we will all rely on.
Can you tell us about the partnership between your organization and Rotary International? How have we worked together, and what are some of the highlights of what we've accomplished?
Well, I think our biggest lesson for us is that partners have different skills and partners matter. It's rather like being married, Mark, where your husband or wife, you're going to be together for 20, 40, 50 years. And how do you adjust to each other and your strengths and how you love and respect them? Well, thus it is with Rotary and UNICEF. I think we've just grown to love Rotarians and to respect Rotarians in every country. So in some countries, there are Rotarians who are rolling up their sleeves. They come out and they help with community workers. There are others where they are surveying and supervising to check the quality for what is going on in these communities. In others, it's that they are out talking to the parliamentarians so that they have a greater understanding and commitment to ending polio in their country. If we get that sort of commitment from our Rotarians and our UNICEF teams, as a team, we can carry out all of the things that you need for actually ending polio. I mean, it's a very exciting partnership.
I think that the what's critical about our relationship is that it's a partnership. It's not just a funding relationship. In fact, together we're funding the critical partners that are delivering polio vaccine around the world. Because we've not just worked together in providing funding, we've worked together in the governance of the Global Polio Eradication Initiative. I've worked with quite a few people from Rotary's leadership over the last 10 years in helping to shape the strategy, in helping to be an advocate. There are many competing demands for attention in the global health and development sphere, and keeping the focus on the progress we've made and the eventuality of a truly historic success in eliminating forever a scourge that has killed and paralyzed children for many, many years. I think the WHO estimates that there's over 17 million children who are walking today because of the efforts of the Global Polio Eradication Initiative. So we've been jointly funders, we've been jointly advocates. Many Rotarians have gone out and worked to support polio campaigns around the world. So it's really, I think about it as one of our most critical partnerships in the success of one of the most important things that the Bill and Melinda Gates Foundation is pursuing together with Rotary in finishing the job on polio.
Rotary led the efforts to establish the goal to eradicate polio, and in 1988, with the World Health Organization, worked to establish the Global Polio Eradication Initiative, bringing together Rotary International, the World Health Organization, UNICEF, Centers for Disease Control and Prevention, and most recently, Bill and Melinda Gates Foundation, and Gabby has joined as well. Rotary's important and impactful contributions are the individual Rotarians themselves, collectively working from community to national to global leadership levels, and their unmatched ability to raise resources for over 3 decades. With Rotary, we have been able to reach key leaders and influencers in communities to vaccinate children in Nigeria, India, Pakistan, and many other countries. Other collaborations I just want to mention in finishing my response are Rotary has also been a strong partner to CDC in our work of global fight against malaria and HIV and prevention and water and sanitation and hygiene efforts. We've worked closely in countries in India, Nigeria, South Africa on Rotary Family Health Days so that we can deliver immunizations, prevent HIV/AIDS, and screen for cervical cancer.
Communities and other response organizations count on Rotary during challenging times. So I'd like to ask, how can we become a more effective partner?
As Rotary considers the lingering effects of the current pandemic, I think it will be a great time to reflect back and looking at your priorities, the priorities of the foundation, and saying, are we working in the right spaces? And the reason I say this is I think Rotary is going to take a great sense of satisfaction that, yes, you are focused on the right areas. Because when we look at the challenges to saving lives in COVID, to preventing disease in COVID, some of the greatest barriers have been illiteracy, have been poverty, have been marginalized populations, vulnerable populations. And these have always been at the forefront of Rotary's goals as a great service organization, is to tackle those tough problems of illiteracy, of conflict, and to build peace, because those are the things that we've learned once again in this pandemic that resulted in particular vulnerabilities in certain populations and made some of the greatest challenges, greatest barriers, some of those problems were to our being able to save more lives and prevent more disease and stabilize economies more rapidly. So Rotary, I think, would take a great satisfaction. There may be some fine tuning, but you know, you're so focused on those big issues that it'll be fine tuning. It won't be a complete overhaul, that's for sure.
And thank you so much to our panel for joining us today. I know your schedules are incredibly busy. Thank you for sharing your time with us.